That's why you should consider an AARP Medicare Supplement Insurance Plan, insured by United Healthcare Insurance Company. It can help cover some of what Medicare doesn't, so you could save up to thousands of dollars in out-of-pocket expenses. Call now for this free information kit and Medicare guide. If you're turning 65 or you're already on Medicare, you should know about this card. It's the only one of its kind that carries the AARP name. See if it's right for you. You choose your doctor. You choose your hospital. There are no networks and no referrals needed. Help protect yourself from some of what Medicare doesn't cover. Save up to thousands of dollars on potential out-of-pocket expenses with an AARP Medicare Supplement Insurance Plan, insured by United Healthcare Insurance Company. Call now for your free information kit and Medicare guide and find out how you could start saving.
Now offering the environment-friendly Green Advantage. Call Garden State Brickface at 1-800-341-2222 and get a $25 dining card with your free estimate.
Welcome back. I'm Walt Kane, and we are in your corner on News 12 New Jersey. The high cost of health care. It was a big issue during the presidential campaign. President-elect Barack Obama says he plans to address it. But what do you do about the bills in your mailbox right now? Our guest this week says you may be able to get them reduced. Derek Fitteron is the founder of Medical Cost Advocate. It's a company that helps negotiate with medical providers on behalf of the consumer. Derek, thanks for being with us.
It's a pleasure.
Are you looking to help people who are uninsured or people who are insured themselves but still stuck with gigantic bills?
Well, in today's economic environment, insured and uninsured people are stuck with bills. The insured people obviously have much larger bills. People that are insured have bills that may be partially paid by insurance, but still are having large balance bills.
Yeah, and one of the dirty secrets of the medical or the healthcare industry, whether you know people realize it or not, is medical providers, whether the hospitals or doctors, they're used to negotiating on some level. I mean, let's face it, if they're dealing with HMOs or PPOs or Medicare, I mean, they're getting a reduced rate from the government anyway. So, I mean, one of the things that struck me as fundamentally unfair is, you know, if you have insurance, you may wind up, that doctor may wind up taking 1/3 as much as if you were uninsured and coming in off the street.
Yeah, well, a lot of what we see is the out-of-network procedures that are not fully covered by insurance. And as it turns out, doctors are willing to negotiate because they have a large amount of uncollectible bills from consumers. So it's fair to the doctor and fair to the consumer if we can find a way for them to come together and come to an agreement on a lower price. The doctor gets paid and the insured employee or consumer saves money.
Is this something that someone can do on their own, or does it, how does an agency like yours really help?
Sure, individuals can do it on their own, but what we prefer is that they use professionals because we have the data, several points of data that we can use, the experience. We use lawyers and industry professionals to do it for them. Some people don't feel comfortable negotiating with a doctor, and we can do that for them in a very professional basis between the doctor and, quite frankly, the head nurse or the person that heads the facilities where the negotiation normally goes on.
You know, there was so much talk about fixing the healthcare system during the presidential campaign. Do you expect that we're going to see a radical reform here, or is it still going to be kind of incremental and we're still going to see these types of issues into the future?
Well, changing the U.S. healthcare system is a challenge that I think we've been trying to do for many, many years, and both candidates had a plan very, very different, but also very tough to implement. Strategies are tough to put into practice. I would imagine that with the goal of universal insurance being a good one, paying for it is where the issue will be. And I think going forward what we'll find is that either in form of taxes or perhaps in terms of premiums going up, there will be need to be a way for us to subsidize the folks that are going to be coming into the medical system under the Barack plan.
And when you're talking about alleviating medical expenses, are you talking about trivial stuff like you know, reducing a doctor's visit from $75 to $50, or are we talking about more expensive things, elective surgeries, testing, that type of thing?
Yeah, we actually do the gambit, but much more so on the large out-of-network procedures with specialists, and that's where people do need an advocate to help them through that because of the need to be more and more a student of healthcare these days. It's being pushed to the consumer because of the financial conditions and because of the complexity of the healthcare system.
So bottom line, the doctors and healthcare organizations understand that getting something is better than nothing, and that's why they would want to negotiate.
That's true, and they also know that it's part of our healthcare system today, And for that reason, they're prepared to do it, and certainly it does not impact care in any way.
How about your insurance company? You know, so often you have a doctor who says that you should consider certain tests, or, you know, and the insurance company doesn't want to pay for it, or they only want to pay a small amount of it. Is it possible to negotiate a better deal with them?
Yeah, we offer a service, and we also recommend that consumers negotiate up front, that they understand the price of healthcare. In our country, we shop for cars, we shop for vacations, but we don't shop enough for healthcare, and we don't determine how much healthcare is going to cost up front. And we offer a service called prospective negotiation, where we help to research what a procedure will cost and then create payment terms to help consumers out. So it's important that either through themselves or through companies like ours, that they do that research up front and determine what both their insurance company will pay and what will be out of pocket.
Well, let's talk about that. You're saying understand your insurance coverage, what it will and won't cover, but also do your research in terms of the cost of what the procedure is going to be, and can you negotiate that up front? Like if a doctor says, well, this would be $1,000 for this test, can you sometimes work it out right then and there that maybe it's going to be $800 or $700?
Sure. It is important, to your first question, that it's very important that consumers do understand their health care policy, and most people, when they sign up for insurance, put the insurance policy away and don't think about it. But you should know your deductibles, your co-insurance, and you should know in-network physicians. If you go out of network and need a specialist, it is very important that in that case you try to determine that price up front, because healthcare, unlike almost any other thing that we buy, we don't necessarily know if it's out of network.
All right, so let's say you've had surgery or whatever the medical treatment is that you've had done, and now you're getting the bill. Is there anything you can do at this point?
Absolutely. If one thing that's very important is that consumers take it upon themselves to check the accuracy of bills. 9 out of 10 medical bills have errors in them. So we recommend that you look at your insurance EOB, the explanation of benefits, make sure that your insurance plan paid what it should have. If you're getting a bill from a doctor, it's important that you make sure that the doctor has billed you for the residual amount correctly. Right. And from there, we recommend that you actually take it upon yourself or give it to a company such as ours that can negotiate those bills on your behalf and get those bills down.
What can you do about drug costs, prescription drug costs, or drug costs while you're in the hospital?
Sure. That's not something that we focus on. There are many, many plans that help to reduce prescription drug costs. But one of the easiest things that consumers can do is take the generic drugs, be a member of any prescription drug plan that they can be a part of. And also, when they are with their doctor, if they're getting a prescription that's going to be multi-month, they should try and order as much of that as possible up front so they can pay one co-payment at the pharmacy and use that drug for several months.
How about those pre-tax health savings accounts or flex accounts? How important are they?
Sure. If your employer offers them, I think they're very important because they allow you to put money away tax-free and use them towards your medical bills. And there's several types. There's an FSA, HRA, HSA. We don't have time to go into what those are, but there are several plans that may be offered by your employer, and if they are, it's very important that you take advantage of them.
Yeah, if you think about it, if you're in, say, the 30% tax bracket, but when all state and federal and whatnot are combined, that's like getting a 30% reduction on your health care bill if you put that money aside up front.
Absolutely, and if you have a health saving account, which is the HSA that I was just talking about, you get to retain anything you don't spend in that account and can invest it for a return over your lifetime. All
right, well, Derek Fitteron, consumer health care advocate, with some good advice for us. Thanks very much, Derek.
Thank you, pleasure to be here.
Well, make sure to join us next weekend. We will talk with a doctor and patient advocate, and they will tell us more about what we can do to take charge of our own health care. Up next, companies claiming to help you get a job working for the post office and then don't deliver. How to spot the scam. Consumer Alert is next.
Hey, Mutt Olive. You're watching News 12 New Jersey. Around New Jersey, around